All right. Thank you, everybody, for coming. For anyone that may be watching online and you don't know, I'm Public Information Director Mike Emery. Thank you for watching. We will be taking questions from our online viewers, but we will also offer questions to the media who are present first. What our agenda is very informal today. It's not like the joint press conferences we've done in the past. We have Dr. John Silvernail, who'll give an overview of a statement. And then we have Greenville Utilities and then Pitt County Schools. They will have statements, and then we'll open the floor to questions. Here we have representatives from the Sheriff's Office, Emergency Management, Animal Services, Pitt Community College. I think that's all we have here right now. But before we get started, I do also want to turn everybody's attention to the coronavirus information of our website. We have posted some information from our municipal partners. Several of our municipalities have sent us information that we have forwarded on that page as well. There are some closures, a couple of declarations of states of emergency. So I don't want to stay on that too long, but I do want to direct everybody's attention to that and guide them to that page so you can see what may be happening in your respective town or city. So that said, let's get right into it. Dr. Silvernail will now have an overview.
Good afternoon, fellow Pitt County residents, response partners, and members of the media. Recognizing the rapidly changing nature of the coronavirus or COVID-19 situation, we've decided to provide these regular media briefings. The format of these briefings may change to accommodate social distancing requirements, but the availability will continue. I'd like to start out by updating you on the North Carolina cases. In North Carolina, there are now 40 cases of COVID-19. We still have 0 cases in Pitt County. We have or are aware of 32 tests that have been done in Pitt County. 7 of those tests have returned negative. None of those tests have returned positive, leaving 25 cases pending at this time. Testing supplies. Pitt County Health Department has 20 COVID-19 test kits on hand, and we have placed an order with the state lab for additional testing kits or collection kits, but have not received those yet. Pitt County clinics are open and operating on normal schedules. We have modified some of our clinic procedures in an effort to increase patient flow and decrease the amount of time that patients have to spend in our office. Our outreach services and in-house group activities, meaning group activities at the health department, are currently suspended. Where possible, those visits are being done by phone or other online applications. WIC and Nutrition has suspended all classes at this time and has implemented federally allowable flexibilities and remote issuance of benefits. Our environmental health services are operating normally at this time. Some additional thoughts. Exposure means being within 6 feet of a known case for at least 10 minutes. So again, I want to say that again. Exposure means being within 6 feet of an infected person, a known infected person, for at least 10 minutes. If you are not sick, you do not need to be tested. Diarrhea has only been reported in 3% or less of cases of COVID-19, so GI symptoms are very rare with this infection. Please continue to wash your hands frequently, continue to cover your coughs and sneezes, get plenty of sleep, eat healthy, and exercise as able. Exercise is a great stress reducer. We are adding additional telephone capacity at the health department for questions. Please call the main Pitt County Health Department number if you have questions or need information between the hours of 8 a.m. and 5 p.m. And the number at the health department is 252-902-2300. Again, 252-902-2300. Or you may visit our website at www.pittcountync.gov/coronavirus. www.pittcountync.gov/coronavirus. And remember, folks, the dust will eventually settle, the sun will come up tomorrow, and we will get through this. Thank you.
We're going to get through all the prepared statements first, then we'll go in for questions. I think up next we have Greenville Utilities. As he's coming up, I do want to say we've had a question online about social services. Are they open? They are open. They are modifying some of their services in the way they provide them. That information is available on the coronavirus information page of the website, and they do have signage posted up in their facilities as well, letting visitors and clients know how they are now delivering those services. So again, I direct you back to the website, and all the information on how DSS is delivering their services and programs is posted there. Coming up now is Steve Holly with Greenville Utilities.
Good afternoon. As we talked about last week at the media availability, Greenville Utilities Commission continues with its pandemic plan. We are implementing different things for that, and we've been continuing to monitor guidance from the local, the state, and the federal level, especially with regard to keeping large numbers of people from gathering together. Greenville Utilities has about 18,000 people every month that come into our offices to pay their bills and conduct other business. And with the guidance in mind, Greenville Utilities has made the tough decision to close our customer service centers to all of our customers beginning at the end of the day today. That means customers who come in normally to the main office building on Green Street, as well as the Greenville Express office on Greenville Boulevard, right across the street from the Olive Garden, those will be closed to the public. We are asking our customers to either pay by mail or conduct services with Greenville Utilities over the phone at 252-752-7166. We are accepting payments in person through the drive-through at the Greenville Express office on Greenville Boulevard. So we'll have lanes that are open from 8 a.m. until 8 p.m. We're extending our hours to make it a little easier for our customers. Payments can also be made and other business can be transacted over the phone, as well as on our website at guc.com. You can start, you can stop, you can transfer service there. And also, if you need to make a payment after hours in person, we do have a drop box that's available at the Greenville Boulevard site across from the Olive Garden, and it's in our drive-through area. So please, we encourage all of our customers to mail in payments or use online, phone, or the drive-through at this time. We apologize for any inconvenience, but your health and your safety is our primary concern. Thank you.
Okay, I think our final prepared statement is from Pitt County Schools. And just to reiterate too, anyone else asking questions, any of our other speakers, we've had some questions about the volume. We're doing what we can to adjust the volume up, but we also ask anyone speaking to speak clearly and speak loudly. Thank you.
Good afternoon. Starting yesterday, the schools started serving lunches, and today we were doing breakfast and lunch. Yesterday we served over 1,200 lunches. Today that number doubled to over 2,400 lunches. Starting tomorrow, we will be delivering lunches throughout the neighborhoods. The schools have those plans online. If you go to the school websites or our website, by 5 o'clock this afternoon, that information will be there for you. It's all over the school's individual social media sites. We'll also show you where those locations will be. Also starting tomorrow, the high schools, the 6 traditional high schools, will only serve as locations where they're preparing food. They'll be prepared in our high schools, and they'll be distributed throughout the community from their high schools, which means they will not be grab-and-go locations. The rest of the schools will stay open for the rest of this week for grab-and-go breakfast and lunch. Moving into next week, we may condense sites depending on how many breakfast and lunches we're actually serving at each individual sites. Our curriculum team has been working the last 2 days to put together what we're calling learning packets. As the governor said a couple of days ago, these are optional teacher work days. These are not necessarily learning days, but these are packets that are designed just to keep the students engaged, keep people connected with their classroom teachers. I've been in several schools today, and what I'm seeing now is teachers recording themselves reading books and putting it on Facebook just so their kids can have that interaction and see what their teachers are there doing things for them. So trying to keep that interaction alive. So that will continue. Those packets are at most of the schools right now. They'll be at the rest of the schools by tomorrow morning. If you go to a school and that learning packet is not there, they'll print it for you while you're there. And after tomorrow, those packets will also be on the buses with the lunches as they're being delivered. So they'll be coming to you in your neighborhoods as well. As we move into next week, most of that will all continue. Then we are preparing online programs, digital learning processes for our students, assuming this, just in case this doesn't end next week. So if it goes on past next week, we're preparing digital lessons for all of our students in some form of fashion, K-12. Thank you.
Would you like to just start off the questions since you're already up there?
Sure, I'm always the first.
Do you have any questions for? Any questions for any of our other representatives? We also have county management, emergency management, animal services, sheriffs. Any questions for any of the others?
I would think Dr. Silver probably, but I'm
alright.
not sure if it'll have any overlap, so. I'll go ahead and start off. Dr. Silver, now, this might be a good question for you, it might be a better question for the folks at Biden, but is there any kind of line of communication between you all and Biden in regards to supplies? That's one of the things that we've been seeing is that doctors and healthcare providers don't have enough face masks, things like that. Is there any communication with Pitt County and with Biden in regards to that?
I do work with the hospital. In fact, I was at the Medical Executive Committee last night to address the various service lines within the hospital. I don't have a direct plug into their supply line, and I don't speak on their behalf for their supplies, but we are coordinating our messaging with them. We are working on clinical protocols. I'm on a number of their committees as well, so that we have a unified approach to this.
And so then also another question, rumors fly around on Facebook. We've seen them, I'm sure you all have seen them, people saying that there might be a confirmed case when that information has to come through you. So for people that are seeing those rumors, are not sure where they should get their information from when it comes to a confirmed case, give us a breakdown of how that information would come out to the public, from that person getting tested to you guys saying,
Okay.
yes, this is a confirmed case potentially. Just give us kind of like that timeline and chain of command.
Yeah, we should be, depending on which lab it is sent to and where those results are reported, those results, if they were to sent to the state lab, would likely be reported to us first. Results that went to a commercial lab may be reported to the ordering provider, meaning the physician, nurse practitioner, or PA who ordered them, and they would need to notify us. At the time that we are notified of a positive case, we have a press release drafted, and we'll fill in the details and release that, as soon as we can after that notification. To my knowledge, there has been nothing returned positive. The state is not reporting anything positive to me. The North Carolina Department of Health and Human Services has a state tracking map up which shows counties that have cases. Right now there are 16 of the 100 counties that have cases. Pitt County still remains among those that do not.
Dr. Silva, for the 32 people who have been tested so far, I know you have 25 still pending. For the criteria for them to get that test, has that changed at all, or is it still the same as it was before when we last spoke?
Tyler, yeah, if they had been to China, if they had contact with a known case and are symptomatic, we would test them immediately. If they have not had travel and have not had contact with a known case, we are asking that they be tested for at least influenza first. And there's a good reason for that, that if they have influenza, there's medicine to treat their influenza. And that would be a stop point in that testing algorithm, in that testing tree. If they're negative for the influenza, if they can be tested with a PCR-based respiratory panel that looks for 12 other diseases, that would be a good place to start. But we understand that that's not available to every provider in the community. Then it's okay to proceed with the COVID-19 testing as long as they're negative on the influenza.
As far as, I know with no positive cases here, but do you have any update update as far as maybe treatment or a vaccine? I know that may be months and months away, but is there anything in that regard?
Sure. The reporter's asking about potential treatments and/or vaccines. My understanding is that a vaccine candidate has gone into phase 1 trials in the Pacific Northwest. So that's a very quick start. A number of antiviral agents are being tried to see if they have activity against this infection. There are some that appear to. Some of those are FDA approved, at least for other indications, and there is one that is not FDA approved that's being used under what's called an investigational new drug approach to see if it has activity against the coronavirus. One thing I would mention, Tyler, is that most infections we've had decades, if not centuries, to study most infections. We've had about 3 months to study COVID-19.
And in regards to social distancing, I know even from this past weekend, some of the younger people have not heeded that warning of social distancing. Can you talk a little bit about the importance of that and break down, why that matters in the whole grand scheme of things?
Yeah, let me go back to the exposure issue for a second. Exposure is what we call droplet exposure, is the primary way that this is transmitted, meaning that someone coughs or sneezes and releases respiratory droplets. Those droplets travel 4 feet to maybe 6 feet at most. So the recommendation and the understanding is that you have to be within 6 feet of that person to get those droplets. And that's the foundation of social distancing, is to move people apart so they're outside of that range that the droplets can travel.
And lastly, some of the things that y'all are modifying at the health department, elaborate a little bit on that, and for folks who still need your services, how you're offering those and all of that.
Great question. Tyler's asking about what we've done to modify our services. Not only do we have to respond to COVID-19, but we have to meet the other public health needs of our community, and we are trying to do that without stripping those capacities at this time. We've taken steps in our clinic to help facilitate the treatment of certain infections, and also to streamline the pickup of contraceptives so that folks seeking family planning assistance can get that in a quicker and shorter format. And again, so we can decrease the time that they have to be out in the community, the fact that the time that they have to be in our clinic. We've also taken steps in our lobby to spread out the waiting area, removing some seats and moving seats further apart so that we're following those social distancing guidelines in our own waiting room as well.
Are you directing people to one place to get a test if they want?
No, we have tried to share the burden across the medical system. There's 185,000 people in Pitt County, so if we sent them all to one place, we would be very quickly overwhelmed. With the availability of the test at commercial labs, it's something that any physician, nurse practitioner, or physician's assistant can collect and send to a commercial lab. So we have tried to spread that across the medical community here so that no one provider is overwhelmed. Generally, we're telling them to go to their personal care provider, and if that's not available, sometimes some people are going to urgent cares, and we are doing some testing on a very limited basis at the health department, again, so that we can keep our staff, trying to keep our staff on their normal roles at this time. You're welcome.
So now we did have one question from online. They want to know if it's possible for a person to have both the flu and COVID-19 at the same time.
I suppose it's theoretically possible, but it would be unlikely. So Mike asked if it's possible to have influenza and COVID-19. Co-infection with two viruses is possible, but unlikely.
This might be a dumb question. This is more of a personal thing. I think about sometimes how you can get a common cold twice a year, 3 times a year, if you're someone that just picks it up. Is this the kind of thing that, say, you get it once, could you get it again?
I think the jury is still somewhat out on that right now, but there's some belief that if you are infected with COVID-19, that your body will produce antibodies to it and that you would not be subject to reinfection. Now, with many of these cold-type viruses and coronaviruses, the normal coronaviruses do produce colds. they do change somewhat from generation to generation, so those antibodies don't always work from generation to generation, but there's some thought that you might have immunity after infection, but still too early to say for certain.
So this is a little bit of a follow-up. So if someone does come with an exposure of the virus, what is kind of the timeline generally for them to show symptoms and things to progress?
The incubation period now is felt to be between 2 and 14 days. Most commonly, patients have shown symptoms on the 3rd day. So if you look at the median, what's called median time to symptoms, it's 3 days.
I'm not even sure who this is a question for, but how are they going to enforce the ban on bars and restaurants and keeping people from going out? Are they going to get law enforcement involved? Do you have an answer for that, or do I need to?
That the governor is hopeful that the people of North Carolina will heed those directions, and that more drastic activity is not needed to enforce those. But I don't know, Randy, would you like to comment on that at all?
Good afternoon. As a part of the governor's executive order 117, when they first came out with the first restrictions, talking about 100 persons or less, in that executive order, it stated that it's a Class 2 misdemeanor and is to be enforced by state and local law enforcement.
Cover all the questions? Any questions for any of the other services that we have here?
All right, thank you for your time this afternoon.
Just want to give one quick wrap up. We did have another question again about social services. Once again, they are still open. They have modified some of their services. I would again direct you to the coronavirus information page of our website. That is right here. It is pittcountync.gov/coronavirus, or available in Spanish at pittcountync.gov/coronavirus-es. Had a question about that. We also have some information that we have posted about our municipalities, about some closures of services they have in the various towns. City of Greenville, Ayden, Winterville, Farmville, they're some of the ones that have sent us information. Also, we've put some information about animal services and some of the modifications that we have to the services that they have. Also want to put out that they are by appointment only. The Pitt County Animal Shelter, Animal Services running that now by appointment only. So that and all other information, again, focused on the coronavirus. I'm sorry, yes?
That reminded me of a question I was going to ask.
For
Well, just how is that going to work with all these layoffs, or all these things that are closing? Are there going to be layoffs? Are people going to lose their jobs?
Scott Elliott, Pitt County Manager. Can you restate your question?
I was just wondering, with all these closings, there's going to have to be some layoffs, or is there a plan in place to keep employees and pay them?
Well, I think both the federal government and the state government are proposing packages right now that are being debated and acted on. So we're looking to see what action they're going to provide in that respect. And your traditional unemployment insurance as well. If somebody is laid off, they could apply for that.
that's everybody. Thank you all for coming. Thank you for your service to the public.